Good afternoon, ladies and gentlemen. Welcome to these final two closing plenaries that the World Health Summit engages and prepares with the World Health Organization to take up key issues in global health. And as you have seen from the program and as you see here on stage, and it's true for this panel and of course the next one, is that there is a stellar group of individuals who are making a difference in global health and who will share their experiences with you. We're of course delighted that at this panel, as we had him with us last year, Dr. Tedros has come to join us. And some of you might have seen this table over there and wondered what's going to happen. At the end or between the two sessions, we are going to have a signing ceremony of a special understanding between the WHO and the World Health Summit. And you have already seen that Dr. Tedros has agreed to be one of the patrons of the World Health Summit. And I think we should all thank him for that. Another host of this session is the Ministry of Health here from Germany, and we're happy to welcome State Secretary Steffen, who will speak to us on some of the achievements and intentions of Germany in relation to global health. We have with us the Vice President of the Republic of Liberia, Her Excellency Jewel Howard-Taylor. We have with us the Minister of Health, His Excellency Luis Henrique Mandetta from Brazil. Welcome, Minister. And we have with us Professor Dr. Kaizo Takemi, a pillar of global health for decades, I must say, and now a WHO Goodwill Ambassador for Universal Health Coverage, but still a parliamentarian in Japan. And that, of course, is also one of the critical issues as we talk about health as a political choice. The term that Dr. Tedros uses regularly is that we are looking, of course, at ministers, at government representatives, but increasingly the role of parliamentarians is one that also plays an important role. And in many countries, of course, parliamentarians become ministers, secretaries of state, and so that close linkage between parliament and government is very important. This session will focus on health as a political choice and discuss in particular how the issue of health has come to be in the agendas of many high-level political meetings, clubs, get-togethers. We know, of course, of the UN General Assembly, but increasingly G7, G20. We hope to touch on the BRICS, of course. We hope to touch on the upcoming EU presidency of Germany. And I think when the World Health Summit was created, that wasn't yet in the stars. And we have really reached a stage of a political presence of global health that is critical. But at the same time, as health has moved up on the agenda, we have a criticism and in some cases less commitment to multilateralism. And therefore, part of the challenge also is how the commitment to health also as a global public good, as something we all need to produce together through political action, is ensured and can be taken forward. So the way this session will be structured is we will hear first from our two hosts, first from Dr. Tedros and then from Dr. Steffen, and then we will have statements and discussion with the distinguished panelists. And I forgot to introduce our colleague from OECD, Stefania Giannini, who is also with us because the intersectorality of global health is so critical. We just had a discussion on the importance of the role of education, But also, of course, others have also used the platform of the G20 and the G7 to take their agendas forward. And we thought it would be incredibly important to also hear that other voice, despite the fact that you have also been health minister. So what a good combination. And that will give a particular richness to our discussion. So it is my pleasure to first ask Dr. Tedros to please address us. Dr. Tedros.
Yeah, thank you. Thank you very much, Ilona. Some colleagues were saying Ilona is the queen of global health. And I asked her if she has chosen the king. Your Excellency, Vice President Howard Taylor, Honorable Minister Louise, Vice Minister Stephen, and our goodwill ambassador, Keizo Takami, and Professor Detlev, all protocols observed, Excellencies, dear colleagues and friends, good afternoon. It gives me enormous pleasure and pride to be back in Berlin for the World Health Summit. As a member of the founding council more than 10 years ago, and now as its patron after almost 10 years, I'm delighted to see the way the summit has grown in both size and stature. Today, I would like to talk about one of the scarcest commodities in global health. I do not mean money. Money by itself is not enough. It's how it's spent, and where, and when. The commodity I'm talking about is political will. We often say that we know what to do and how to do it if only there was political will. It's the biggest deficit we face. Health is a human right, a fundamental human right. I have been practicing this in German, by the way. Gesundheit ist ein Menschenrecht. Is it right? Vielen Dank. But it's a right that must be realized through political choice. It's a choice that Germany made 135 years ago in the Bismarck era, Chancellor Bismarck. It's a choice that Japan made, not when it was strong and prosperous, but when it was weak after the Second World War. It's a choice that Brazil made in 1988, when it adopted a constitution that says health is a right of all persons and the duty of the state. It's a choice that Liberia has made as it rebuilds after years of civil war and the devastating Ebola outbreak of 2014. These four countries show that each country has a different path toward this universal health coverage, and each is at a different point on that journey. There is no one-size-fits-all approach, but they all have the same destination, and they all have the same starting point, a political choice. The starting point in all countries, 4 countries represented here, was a political choice. Today, there are many other countries making the same choice and forging their own path. Egypt, the Kyrgyz Republic, Peru, the Philippines, Rwanda, South Africa, Thailand, Tunisia, and more. In fact, I believe we're living at a time of unprecedented political commitment for health. Just in the past month, there have been 3 very significant demonstrations of that commitment. First, at the United Nations General Assembly, all 193 member states approved the political declaration on universal health coverage, the most comprehensive intentional health agreement in history. But unless it's implemented, it's still a paper, by the way. Second, just as countries are coming together, so the international health community is also coming together to support them. The General Assembly also saw the launch of the Global Action Plan for Healthy Lives and Well-being for All. This is a unique commitment by 12 multilateral agencies to work together in new ways to support countries to accelerate progress towards the SDG health targets. Together, we will engage with countries to identify their priorities, to accelerate progress through their joint action, to align our operational and financial strategies, and most importantly, to be accountable. As you remember, the initial draft of the Global Action Plan for Healthy Lives and Well-being for All was launched at this meeting last year. Importantly, it was endorsed by the G20 leaders in the communique that came out of the Osaka summit in Japan earlier this year. I would especially like to thank Chancellor Merkel, one of the prime movers behind this historic commitment, and also to Prime Minister Abe for his long-standing commitment and global leadership on UHC. Third, at the Interparliamentary Union Congress in Belgrade 2 weeks ago, countries adopted a resolution on universal health coverage, committing to leverage the power of parliaments to translate political commitment into hard realities. And it was, by the way, one of the assemblies that was attended by a good number, the highest number of speakers from many countries. Taken together, these 3 documents have brought us to a unique moment in global health. There has never been a better opportunity to work together to transform the health of billions of people. History will not judge us kindly if we fail to grasp this moment and capitalize on it. We still have a long way to go on the road to UHC. On current trends, up to 5 billion people will lack access to essential health services by 2030. That means children not getting vaccinated, expectant mothers, and people with chronic illness unable to see a health worker, or people without life-saving treatment for HIV. Although we have made enormous progress, we have also learned valuable lessons. We cannot improve global health one disease at a time. Changing patterns in demographies, economics, and politics put new stresses on already overstretched health system. Our failure to invest in health systems doesn't only leave individuals, families, and communities at risk, it also leaves the world vulnerable to outbreaks and other health emergencies. Health systems and health security are 2 sides of the same coin. The ongoing Ebola outbreak in the Democratic Republic of the Congo illustrates this point with devastating clarity. The weakness of the health system, coupled with insecurity and political instability, has created an environment ideally suited for Ebola to spread. Thanks to the government's leadership, the selfless dedication of thousands of health workers, and the support of donors like Germany, the outbreak has been reduced to less than 15 cases a week from more than 120 at the peak in April. But any Dankeschön. But any single case could spark a new and bigger outbreak. Until we get to zero, we're in full response mode. We will end this outbreak, but unless we address the root cause of the outbreak, the weak health system, there will be another. We must ask ourselves whether we will invest in preparedness now or wait for the next outbreak and spend far more trying to stop it. But the power of preparedness, we have seen it in Uganda. When few cases crossed the border from DRC to Uganda, it was controlled with a swift speed. And thank you, my sister Jane here, the Minister of Health of Uganda. She is with us here. And that's the dividend of preparedness. But what we see with Ebola case now, this is not just an issue in the DRC. It's a global myopia. The recent report of the Global Preparedness Monitoring Board shows that the world remains dangerously unprepared for the next global pandemic. It's frankly difficult to understand why countries would invest so heavily in protecting their people from terrorist attacks, but not against the attack of a virus, which could be far more deadly and far more damaging economically and socially. A pandemic could bring economies and nations to their knees, which is why health security cannot be a matter for the health ministry alone. We are now preparing to bring foreign ministers, finance ministers, health ministers together in Marrakesh next year to discuss how to step up the implementation of the international health regulations globally to keep the world safe by investing in preparedness. Excellencies, dear colleagues and friends, let me outline 3 challenges that we must meet in order to realize the commitments we have made. First, universal health coverage is not a choice a country makes once. It's a choice that must be made every day in every policy decision. Disease patterns are always changing, and so are the needs and demands of populations. There are always people at risk of being left behind. There are always new challenges to confront, like antimicrobial resistance and the health effects of air pollution and climate change. New treatments offer many benefits, but also pose new challenges for the financial sustainability of health systems. WHO stands ready to work with all countries at all income levels to provide our technical expertise on how to ensure countries make the investments that deliver the greatest impact. Which leads me to my second challenge, primary health care. There is simply no better investment in health than primary health care. It's the smartest investment. That's why WHO is calling on all countries to increase spending on primary health care by 1% of GDP by 2030, either through new investments, reallocation, or both. Globally, we need a radical reorientation of our health systems towards promoting health and preventing diseases, not simply managing them in hospitals. To do that, we need to address the reasons people get sick and die. In the air we breathe, the food we eat, the water we drink, and the conditions in which we live, work and play. As part of WHO's transformation, we have accelerated a new division. We have created a new division of healthier populations to support countries to address the economic, commercial, environmental, and social determinants of health. This will help us to focus on the root of health problems and keep people healthy. Third, multilateralism. In our fractured and divided world, Health is one of the few areas in which international cooperation offers the opportunity for countries to work together for a common cause. Health as a bridge, even for peace. The political declaration on universal health coverage, the Global Action Plan on Health and Well-being for All, and the Interparliamentary Union resolution on UHC all demonstrate that the death of multilateralism has been greatly exaggerated. It's alive and well. The G7 and the G20 are both vital fora for promoting the healthier, safer, fairer world we all want. Multilateral engagement is not only the smart option, it's the only option. Working together for a healthier world not only improves the lives of billions of people, it also builds a platform for sustainable development and can truly be a bridge to peace. We're one species. We all share 99.9% of the same DNA. We share the same planet. We share the same hopes and dreams, rich and poor, rural and urban, citizen and refugee. I like one saying, actually. There are two types of people on earth because life started in Africa. There are Africans and former Africans. Then some colleagues corrected me and said, don't call them former Africans and diaspora. And it's true. We may never agree on which system of government is best, or which system of trade is best, or which economic system is best. Some of us are left, some right, some in the middle. But we can agree on this. Health is not a privilege for the few. It's a right for everyone, everywhere. Our job as politicians and as leaders is to defend that right every day and to make it our life's work to see it realized. All roads lead to universal health coverage. If we believe in health for all, we can make it happen. Thank you very much. Vielen Dank.
Thank you very much, Dr. Tedros, for those important points that you've shared with us. Also, some of the humor you always bring to global health as well. But the big challenges, the big political challenges that you have highlighted, and we will be taking them up in the panel. It's my pleasure now to ask State Secretary Dr. Steffen to please take the rostrum.
Madam Chair, distinguished speakers, ladies and gentlemen, let me start by saying it's a great pleasure as a former African to speak to you today. And to be honest, I'm still working on my status to improve it step by step, to come closer to Dr. Tedros, but this will take some weeks, months, or even years, but let's see next time. It's a great pleasure to be with you today and to speak to you also on behalf of my minister, Jens Spahn, the health minister of Germany. And to be very honest, Dr. Tedros and his speech was very perfect, was very complete, so I have to admit, nothing to add. If I reflect for a second, maybe there is one thing to be added. The title of today's panel indeed is an important one. It's about health as a political choice. And indeed, it is very true that health is a political issue in itself, because health can really change societies. Health policies can move societies forward. And that is why we need the discussion about the best way forward. And it's closely linked with the question of the multilateral approaches that we see today, we have seen in the past, and hopefully we'll also see tomorrow. And I've been working in the finance ministry for many years, very closely working together with one of the original multilateral institutions that still exist on an international basis, the International Monetary Fund in Washington, which, as you all know, was founded in the year 1944 as one of the Bretton Woods institutions, still working together very closely with its own partners on a global basis, giving good advice, also sometimes giving some money, hoping to get it back. But this is all about the tasks and the goals of international institutions. And to be honest, I've never imagined over my past years that today is the time to really stress the advantages of a multilateral approach and multilateral approaches on a global basis. For me, it was always normal to work together with multilateral institutions like the IMF. But today, multilateralism is challenged by some on a global basis, and that is why we have to stress the benefits and the advantages of multilateral approaches. And I still remember when I heard at the end of 2018, my former colleague, the first deputy managing director of the IMF, David Lipton, saying in a speech, no, he was quoting Winston Churchill with regard to those challenging multilateralism on the global level. He was quoting Winston Churchill, and Winston Churchill during the Second World War said with regard to the United States, the price of greatness is responsibility. And in my view, this really points to the real thing that we have to discuss. It goes along greatness and responsibility on a national basis, and that is why we really have to work together in those multilateral fora. We have to continue with that. And of course, it goes without saying that Germany is a strong supporter of these rule-based multilateral approaches, and we will continue with that. And we, of course, want to further link it with the question of health policies and the political choice related with that. We did it first time back in 2015 when we had the G7 presidency, the German G7 presidency. So we have brought health to the agenda, and we have done that again in the frame of our G20 presidency during the year 2017. And I have to say that it worked quite well to work with our partners on that level. Before that, I guess it was not very normal that we discuss financial issues in these fora like the G7 and the G20. But after that, it should be quite normal, and we are very grateful to our Japanese colleagues that we continued with bringing health issues to the global agenda and the G7 and the G20 agenda. And we all know we still need that because we are living in a very, very complicated world where we really have to steer processes to bring things forward. And one of the good examples over the past weeks and months certainly is the Global Action Plan on the SDG 3, which was launched just some weeks ago in New York, which illustrates, in my view, that we have a lot of good and excellent international organizations working on the same goals and the same targets. But we, of course, have to bring them together to bundle their forces and to even make themselves stronger in the sense that it is for the benefit of all the member states and their partners on a global level. So the implementation of the Global Action Plan is key for the next month and years to come. And my last point again comes back to what I just mentioned. What is next on the global agenda and when it comes to the G7 and to the G20 agenda of this year and the following years. I've read the Okayama declaration, which was issued, I guess, only 1 week ago. And again, I have to congratulate our Japanese colleagues for their very, very successful presidency. And it illustrates especially one thing. The declaration illustrates that in future times, we even have to work closer together on a more cross-sectoral basis. Because what our Japanese colleagues did is, especially to bring finance ministers and health ministers together, I guess for the first time. And it makes a lot of sense. I would call it expertise meets money. And we need both. We need the health expertise, but we need the funding and the financing to implement our health policies. And that is why, let me conclude, I can only encourage the incoming G20 presidency, Saudi Arabia, and of course also the incoming G7 presidency, the United States, to follow this very, very excellent example of our Japanese colleagues and to do the same in the year 2020. Thank you.
Thank you very much. Thank you very much, Dr. Steffen, and the messages that you've given us, expertise meets money, is something that we'll be able to pick up in a minute. I'd like to turn to Her Excellency Taylor from Liberia. We've heard we're all Africans, and but we also know that your country in particular has had a very strong role in putting health on the agenda of the African Union. And if we're talking about organizations, also multilateral political organizations, particularly at the regional level, can you share with us some of the experiences and also the expectations around the role that the African Union can play in relation to global health?
Good afternoon to everyone. Thank you for this opportunity. I would like to, before I get to the question, just add constituency to the mix. Finance, expertise, constituency. Because in the end, what we do must affect the people that we serve. They shouldn't be left behind, and maybe bringing some of them to the table will begin to help us as we deal with all of the issues that we have. Thank you. The African Union, looking at the issues of healthcare and the importance of it, because health is actually wealth. And I think we agree that it is a political tool, because governments must ensure that the environments that are provided include basic services. Unfortunately, even though everyone in this room is from Africa, the fact of the matter is that Africa carries the largest burden of the healthcare issues that we talk about because of many reasons: poverty, war, not prioritizing the issues that should be prioritized. But in Abuja, they decided that they would make a minimum of 15% available in the healthcare budgets to begin to deal with some of the issues at the local levels. Again, if you look at my country, and as we discuss these issues in an academic setting, we must look at the realities. Our national budget is still just 7%, as it is in many countries. We look to international funding more than we look to what governments provide. And during our lunch break, we were talking about how do we deal with it. And I think the African Union is also looking for ways to make these commitments, not just words, but actually action. And I thought the way that they've decided to deal with it is the issue of prevention, which I think is the biggest aspect of healthcare. How do we ensure that people get the information that they need to make the best choices so that we don't deal with diseases and that we deal with a situation where people are able to live a proper life in an environment where they are not ill and that they're able to perform in ways that protects the families and the communities. The African Union is also looking at the issue of SDGs as a collective item because they're all interlinked. And you know, as a gender activist, if I don't say this, you know, I'll probably be shot when I get home, and that's just a joke. But the fact of the matter is, let's look at gender equality as a central point. And President Kagame and other leaders on the African continent have begun to take a look at how we can ensure that gender equality, which actually is the linchpin for all of these items. If you empower a woman, she will take better care of her children. They will have better access to health care and water and environment and education and energy. But if we look at healthcare as an item by itself, someone said earlier this afternoon that we might not meet the targets. And I think that is what the African Union is afraid of. What do we do in terms of putting in place the regimes that we need to ensure that somehow we're able to achieve these goals instead of just having numbers? The African numbers are very, very, very bad. For the first time, there was an SDG report launched earlier this year in Kigali. And when you look at the numbers of all of the individual SDGs, including healthcare, you'll find out that most African countries, except Rwanda and a few others, are not doing well at all. So I think as we look at it as Africans, we must underpin it under the empowerment of women, because I believe that women who are empowered take care of the families, they take care of whether you're young or whether you're an ailing parent, and they find a way, if they are empowered, to ensure that you have a better healthcare system. But universal healthcare is key. The reason why women do not go to the hospitals while they're pregnant during the 9 months is because they have no insurance, they have no health care, and so they stay home until it's time to deliver. 9 times out of 10 women die in those instances because there's no history of what the problems could be. As we deal with HIV and AIDS and transmission of mother from mother to child, they're not tested. So no one knows if you go into labor whether there is a procedure that can be done to ensure that that transmission isn't done. So it's a holistic issue, not just of communicable diseases, but also non-communicable diseases, some of which can be taken care of just by changing your diet. High blood pressure, diabetes, those things are related to what you eat, how you live. So I think as we look at healthcare, we're hoping that we can begin to change the mindset of our people to look at preventative measures instead of always looking at what can we do to get more drugs or to do more research in how we can, take care of the diseases that we have. If we just change our mindset and change some of the things that we do on a normal basis, I think the issues of healthcare will be minimized, and then maybe governments will be able to afford universal health care for all of its people. I think that would be my initial comment. Thank you.
Thank you very much. Minister Mandetta, Brazil over the years has been a leader in many aspects of health at the national level, but also taking those issues to the international level. So could you share with us particularly the role Brazil has played in this multilateral system, how you've positioned yourself, possibly also with other countries from the Latin American continent, and why, in what way you think these organizations like G20, the discussions at the UN, maybe at the BRICS and other entities, why are they important for health?
Well, first, thank you, Ilona, for inviting us and all the organization of the summit. If she's the queen of global health coverage, you're the king, Mr. Tedros. So no way to run from it. You are the one now. Well, I've been to this whole talk about universal health coverage. I've been to Osaka. Me and my finance minister and all the G20 were trying to make the marriage between the finance and health, guys. I hope it doesn't go for a divorce after that, but we're struggling for it. And Brazil made this option 30 years ago, 1988. We were writing our constitution. It was the worst time for our economy. We made a decision to make it universal for everybody, integrality, and equity. And when we compare where we were before this universal health coverage, our numbers in health and how we made on this 30 years. Being a low-income country, then a medium-income country, it's unimaginable where would we be today if it wasn't for that choice of those constitution members that made this constitution right. So we bring this history very close in our minds in the G20, in Mercosur, which is our regional bloc. We just signed a multilateral agreement with Europe, and there's the chapter on health that we really stood all together on it. I was, during 8 years, a congressman in Brazil. I also a congressman for Mercosur. We have the Parlasul, where we had those talks all together. And what we've been trying to do is show our people and our Congress people, because what we see, and probably that happens in all democracies, everybody that runs for a seat in the Congress, when they ask for votes, they all say, I am going to work for education and health, no matter which country they try to be representative to. So we are trying to bring all of them together. Now in the Mercosur, we are arranging to do the vaccines for all the frontiers. We had measles back in Brazil, in São Paulo. We are struggling to bring it to a normal level. When you have vaccines low, no matter where you are, it means that the primary care system is also low. So we are reorganizing our system through primary care investment. The whole reorganization is passing from all those spaces where we talk about health. And it's been very pleasant to see that the world is talking about it. Your leadership is making progress. We just had the BRICS last week, and the BRICS is different from everything that you must experiment, because we are one country, Brazil, South Africa, Russia, India, China. We are pretty much distant on cultural, on different stages of development. But what brings us together and makes us stronger each time we have our meetings is that we have a common agenda, even though we are so different. We are talking about more than 3 billion people inside the BRICS. And we know that tuberculosis, if we can do a good job, we probably, inside the BRICS, we have almost 50% of the cases. So we are starting to make now the international call for all scientists, for vaccines on TB, for new technologies. It's amazing how when we see tuberculosis and we see Koch is the one that saw the Mycobacterium about more than 100 years ago. If he could come back today and stay here and say, what have you done about tuberculosis? You say, we are using your microscope, Mr. Koch, but we are doing good. I mean, we didn't make research, we don't have new tools, so we are running after it. And when we talk about it, in all those places, and this summit also, is to call the attention that we are all together. Globalization means movement. People come and go. Dr. Tedros was very fortunate in his speech. I agree with my German colleague. Hey, there's not much to say. The ones that think about defense and trying to keep them safe, and we think about health, sanitary way, the next threat is going to come, and everybody's going to look one to another and say, how can we stop this? Because that's the big threat. So all those forums are being very helpful, and Brazil is trying to bring his agenda to all of them and open to new looks on health, and it's been very, very important for all of us.
Thank you very much, Minister. And you just made the heart of the director of the German Robert Koch Institute beat a bit faster as you spoke about that tradition also here in Germany. And the Robert Koch Institute is also developing its global role in a new way that we hope will contribute also to the kind of issues that you have raised. But thank you also for raising those other fora, because we talk about G20 and G7 and the UN, but also hearing about the BRICS, the Mercosur, other fora. We've heard already about the African Union, I believe is very, very critical, and some of them are come together for different political reasons of constituency, but we can see that practically in all of them the importance of health has increased, and there it always needs the leadership of countries to take it forward. And we are of course very lucky to have with us Professor Takemi, who has played a critical role in relation to Japan putting health on a variety of agendas. And this year, Dr. Takemi, has been very, very special because Japan has actually been approaching this, I don't know, like a domino game or a chess game or maybe like a Go game, to say, here's the G20, here is the UN General Assembly, here is the World Bank meetings, here is our own TICAD meeting, etc. And you've managed to create a synergy for UHC, which is quite extraordinary. Can you tell us a bit about that strategic thinking and why the Japanese government has said UHC and health needs to be at the forefront of all these discussions and they need to influence each other?
Wow, it's a big subject, but I can tell you that the highest level of the decision making is absolutely important, and consistency of the leadership is always required for. It's really a fortunate thing that our Prime Minister Abe and Vice Prime Minister Taro is also the finance minister, they both had wonderful concerns with the health issues as a common beyond the national boundaries. And also the Japanese government, when we was a host of the G8 in 2000 and G8 in 2008 and G7 in 2016, right after the adoption of SDGs, and also the G20, as you mentioned, that this year. Consistently, we picked up the health as a key agenda for G8, G7, and the G20. The reason why, I can tell you the two reasons. One is our own experiences of the health policy development after the World War II ended. When we achieved the universal health coverage in 1961, Japan's per capita income was the $4,180 US. One of the reasons to achieve the universal health coverage then was not only to secure the access to the qualified primary health care for their own health only. We also recognize that the universal health insurance system itself shared the more than 70% of the government capacity to reallocate financial resources from rich to poor to increase healthy middle-class society. So the multilateral, the purposes are required for our approach to achieve the universal health coverage. Our leadership knows it. Therefore, health is a really core part of the nation building. And then the next factor is that our war experience, World War II, just like Germany. We should have the pacifism as a very key, multilateralism in our own domestic politics. Keep a very peaceful nation. And then our policymakers now shared the concept of human security as our future-oriented pacifism. And then the health is a core part of the human security concerns. Therefore, in 2007, 1 year before the 2008, when we was a host of the G8 summit in Toyako, unfortunately, I lost my job at the upper house election. The then Prime Minister Fukuda requested me to be the task force for agenda setting and policy proposal to the G8 at that time. And I proposed him without any hesitancies. The health should be given a highlight for the G8 summit. The Prime Minister accepted immediately and said, oh, this is the core part of human security. So you can see that those two reasons, our own future-oriented pacifism and our experience of the health policy making in the past is two very important factors, the reason why our leadership consistently have a great concern with the global health as a common agenda for ourselves. Therefore, our Minister Abe, when he was a host of the G7 Ishishima summit right after the adoption of SDGs, he proposed that the achieving universal health coverage as a one pillar, and strengthened our crisis management system building for the second pillars. And third pillar was the fight against the increasing risks of the AMR. And the three framework is now the very important framework of us when we commit on the global health. So the multilateral collaboration and public and private partnerships should be combined under the same umbrella. And then we recognize that the health minister should not be isolated within their own government when he or she try to achieve the universal health coverage. Should have the real partner outside, specifically the ministry who has the money. Therefore, we had a very serious consultation with the Tedros. You remember that? And also the Jim Yong Kim of the World Bank, and Prime Minister Abe, and our Vice Prime Minister Tedros consulted very closely and tried to highlight on the UHC finance should be given the first, highest priority right after the adoption of SDG 3. And then we have to find out how to create the collaboration between the health ministers and finance ministers. And then we utilize the occasion as a host of the G20 and propose to have the joint meeting for health minister and finance ministers. I really appreciate that the wonderful collaboration of the government of Germany. The Germany consistently, very closely collaborated with us and build up the consensus among the member states of the G20, and successfully we organized the first meeting of the first joint meeting for the finance and the health ministers, and publicize the joint statement in which we encourage every finance ministers to collaborate with health ministers. That's one of the first process I would like to explain. Thank you very much.
Thank you very, very much. And I do think it's quite extraordinary if we keep that in mind, you know, this very long-term commitment, a commitment that's very closely links the national commitment to health as a social contract, elements of redistribution, etc., and the global and the multilateral commitment, and then truly long-term strategic thinking to think about which multilateral entities, bodies can help us take this agenda forward, and with whom do we partner in order to do that. So I think there's a lot of lessons to be learned from this. And I'd like to turn to Dr. Giannini, because you've been involved also both in the G20 from the education side, and you got a very strong, I believe, declaration from Argentina from the meeting, but also you were involved in the recent G7 meetings with France, of course, hosting them, where there was also a lot of discussion around the equity issue that has been raised by Her Excellency, about the gender issue that was raised by Her Excellency, but also the issue of multilateralism. And can you share with the audience some of those experiences and what we can take away strategically?
Thank you very much. Let me, first of all, thank for this invitation. UNESCO, the World Health Summit, it's not so obvious, but as a first message I'd like to send, it's about the importance and the powerful role of linkages between health and education. The title of this panel is Healthcare is political choice, education as well. And joining our forces, we can really influence the agenda of policymakers and bring together health and education ministers as labor and education ministers. You mentioned G20 in Argentina last year, can really make a difference, can really allow us to think differently and act differently. And it's about prevention, for sure, mostly referring to not communicable disease, but not exclusively. I could mention some good example later. And it's about building and sharing a culture of well-being, so building a health environment. And let me say it's about approaching the 2030 agenda as the most ambitious project we had at international level about building a better society and development, sustainable development, thanks to an integrated, cross-sectoral and comprehensive approach where all the 17 goals are absolutely interconnected. So it's quite important to bring together our experiences. Let me mention some data that can really demonstrate to what extent education is crucial in order to implement SDG 3 and how it can, bring together our implementation action plan. Girls, we know education are 3 times likely to marry by 18 than girls who have been educated at secondary level. And an additional year of secondary schooling reduced risk of HIV infection by 12% among girls. So I think these 2 simple numbers are enough to demonstrate concretely how can we put in the same action plan these 2 different perspectives and bring together SDG 3, SDG 4, which UNESCO is responsible in terms of coordination in the multilateral platform and international architecture, and SDG 5, which is about gender balance. So what we did July this year at the G7 in Paris was about organizing with the French Ministry for Europe and Foreign Affairs a big conference and international meeting with the G7 ministers and the Sahel ministers together, the same discussion around the table. And it was about concretely proposing measures and policies to address some crucial issues that in African countries mostly are real obstacles for quality inclusive education, but I should say for health and well-being life for children today and for adults tomorrow. And there are really obstacles to health, access to health, and building a health environment in society. This project, this program is about sexuality comprehensive education. We reached today, until today, 5 million learners, girls mostly, and we have a target of 20 million learners in terms of girls who are in the school process, and 30 million together with the community which is around learners. So this is about preventing early unintended pregnancy, early marriage, as I mentioned before, and this is about also giving girls the choice to choose their own life. So G7, in this case, was really the global platform where we could launch this initiative, relaunch, because it's already some years of successful program on the ground. And let me say this is a real evidence of to what extent it's important to bring together different kind of perspectives. So the next step should be after Tokyo G20 this year, where the Japanese government, I was there in my current position as Assistant Director General for Education at UNESCO, put together education and sustainable development, the so-called ESD. And Argentina was about last year labor ministers and education ministers. Maybe next step, hopefully, in Saudi Arabia next year, they are focusing on early childhood, which is quite close to the link between, the linkages between these two sectors. Should be great to have an initiative which can put health and education ministers together. We already experienced something like this at UNESCO 3 years ago, and the outcome, quite concrete, still very successful project is the Eastern Southern African commitment to young people for preventing for sexuality education. So I think that this is a very good big picture where multilateralism, as you said, can really give an added value. And if and only if, I should say, we are ready to think differently and act differently. And this is about partnership and also putting together different kind of experiences like the community of education, the community and health, because one of the risks we have, this is the same for education, that the same people around the table is discussing about the same topics without sharing with other kind of partners the different kind of experience. So thanks a lot for inviting us, and we are ready to contribute from the education perspective to healthcare as a political, very much political choice. Thank you.
Thank you very much. And thank you also for widening our perspective in a different way. You know, when we get these statements from, let's say, the G20 or the G7, the health people tend to look, where is the health chapter? You know, how many lines did we get on health, etc., rather than perhaps, you know, go through the whole thing and say, where in this declaration are also key determinants of health being addressed? Where can we build alliances? Where can we break the silos? in order to move forward? And then, as you have indicated, where can we build alliances? I'd like to go back to Minister Mandetta and ask you, Minister, if we look at this political sphere that we're talking about, in a way, it's starting to change the role of health ministers. Health ministers probably in the past were much more nationally focused, and now they need to be more outward looking, they need to be more globally involved, they can shape global agendas in a new way with other partners. How do you see that role changing? Is it a role that's easily accepted also within government? Do others say, like the foreign minister, why are you there? We've always been there. So can you say a little bit about that changing role and what we should expect of a health minister in this day and age?
My foreign minister say, please go. It's becoming each time more natural and more necessary because health became a global issue when you look at the numbers. Brazil is a very large soybean producer. So we have the champions, the states that are champions on production. Mato Grosso do Sul, and Paraná. We spend the whole soybeans production of those 3 states, and believe me, they are large production states, only in our health debt on the international health issue. Almost $28 billion. This makes, we have to go to other countries and try to bring bridges on education, on research, on trying to make better deals to buy the things that we need. Because when we are talking about universal health coverage, when it comes to promotion, everybody agrees. When it comes to prevention, everybody agrees. When it comes to attention, how to take care, then it starts the arguing. And rehabilitation is even less talk. So the ministers of health are almost for survival. They must be an international player. They need to be in those forums. They need to talk. They need to find bridges. One of the things that we are really going to need is people to work in the health system, because we're talking about health system as if it's an imaginary thing. It's done by nurses, by physicians. We need to support them. We need to give good graduation, pay good salaries, because they are the ones that are going to take care of our kids, our grandchild, and they are the workers that really support it. So if we don't do that in a global basis, we are not going to be able to do many things that we dream about doing. So each time more international, each time more trying to find good connections, good people, goodwill people, and we find them in every country. They're all there trying, they're decent people trying to do their best, and differences on how to do it, they exist. But as more as we meet each other, as more as we know each other, the easier it gets to build good policies. So I think that this kind of ministerial health that looks inside their country only, they are probably in this 21st century, the gene therapy is coming on our way, the tailor-made medicine is coming in our way, and if we don't sit and try to establish a standard, is this a human good for humanity? Or is it something that's really going to break this bridge even more? We're talking with the Portuguese-speaking countries, mostly in Africa. I'm going to Angola in a couple of weeks. We are doing the Human Milk Bank, which Brazil brings to more than 50 countries around the world. We put it as a network for BRICS now, which is only technology of primary care to provide feeding premature babies and lowering childhood, which is made by the workers of the health system. There's no technology, it's just the way that you do it that we bring in. It makes a huge difference. And this is done because we are sitting in all those forums, and that's why I really appreciate you inviting us to be here.
Thank you very much. Dr. Steffen, for Germany, in a way, there's 3 levels of activity, if I can call it that. There's, of course, the national health policy. There's global health that has become very important. But, of course, Germany is also a member of the European Union. And next year, second half of next year, Germany is going to have the presidency of the European Union. There is great interest, and the minister already indicated it in his opening speech, that global health also becomes an issue that Germany takes to that presidency and moves it forward. Could you share some of that thinking with us as to how you also see, maybe in a larger way, the role of the European Union as a global health actor? And of course, it is one of the largest donors, obviously. It's Dr. Tedros is regularly at the European Development Days that are very, very important. But you know, there are many cross-border issues, many trade issues, the Mercosur agreement between EU and Mercosur. Could you give us some idea how Germany is thinking about that right now?
Yes, thank you. And let me first follow the, I would call it, Brazil example to also stress one point. I think we are now in the course of discussing many, I would call them systemic issues, and how to improve systems on a global basis and how to learn from each other. We'll come back to that in a second, but I would totally support what was just said. At the end of the day, the system always has a serving function, and we have to look at the patient, we have to look at the people in the street, we have to look at the health workers, the nurses, the doctors taking care. So whatever we discuss is, at the end of the day, that it must be measured against, will it improve the life of the people in the street? Will it improve the life of the patients? And this is also something that we have to discuss further in the European Union. And there's a lot of work ahead of us when it comes to these systemic approaches. I do believe, and again, you find everything in the Okayama declaration of our Japanese colleagues. It's about better funding of national health systems. It's about better cooperation on a cross-sectoral basis between health ministers, finance ministers, and the further ministers relevant for these issues. It's also about setting new priorities. If you look at the Okayama Declaration, one example is a very important one, how we can ensure a good life in aging societies, and how to fight dementia and other diseases, where especially in Europe, but also if I compare it with other areas of the world, we have to face the same challenges, and it would be stupid not to learn from each other and to also look at our Japanese colleagues and what you are doing in Japan. So this is what I would call the learning exercise to make the systems more effective and more efficient. And this is exactly coming back to Europe and the European Union, what we want to do and we want to achieve during our European presidency in the second half of 2020. And by the way, let me also stress the point, what was mentioned some minutes ago, the European Union can also learn from other areas of the world. And we are very willing to pick up that point and to also talk to the European institutions how to be in a close contact with Mercosur, with the African Union, with the BRICS states, and so on and so forth, though there's still room for improvement on a continuous basis. And on substance, our priorities for the European presidency is about digitalization. And my minister visited some African countries just some weeks ago. And I have to say, we can learn from our African colleagues also when it comes to digitalization. This is very true. And what we set on the agenda for the second half of 2020 is the question how we can bring forward the exchange of health data in a European data space, how we can use the data on the European level, how we can use it for artificial intelligence, for personalized medicine, how to improve the diagnosis and the treatment, the therapy. At the end of the day, again, patient-centered, to look at the people and the benefit of the people at the end of the day. This is what we want to discuss, we want to achieve. And the second point is exactly about how digitalization will have an impact on the life of the health workers. What about the training of the health workers? What about their future education? What are the challenges? And again, how we can learn from each other also on a global basis, what the European Union can learn from other areas of the world. And there is a second or third challenge during the second half of 2020, and is especially when it comes to the WHO, very important, I guess, also for Dr. Tedros. We really want to discuss with our European colleagues to what extent we can strengthen the European voice in the World Health Organization. Because for the time being, for many good reasons, and because many health systems, of course, at the same time and primarily are national systems, we again have to bundle our forces, and we should discuss what we can bring from the European Union back to the WHO in future times when it comes to policies. But hopefully, Dr. Tedros, also when it comes to financing and when it comes to funding, to make the WHO even more stable and more sustainable for the challenges to come in future times. Thank you.
Thank you. I think that deserves a clap. WHO needs that. Thank you. We don't have much time left, but I do want to have a few short comments, first from Her Excellency, again in relation to Africa's voice in many of these fora. There are also these many meetings that are taking place, China, Africa, India, Africa, Europe, Africa, many of these summits that sometimes also have health on their agenda. How do you see the African voice here developing? What are the things that you set as your conditionalities in a way? How do you want the global health agenda discussed?
Thank you. I want to just piggyback with one of the colleagues who talked about the issue of healthcare being multi-sectorial, and we can't ignore that. Finance, agriculture, security, infrastructure, foreign affairs is all interlinked. And I think as we discuss an important issue as healthcare, as it relates to poverty alleviation, we must ensure that all of those parts come together so there are holistic programs that can actually help us. But when we look at the African Union and what we have to bring to the table that helps others as they look at some of the issues they handled, is let's look at the Ebola, for example, that ravaged the Mana River Union countries in Africa. What did we do? At the end of all of the processes, we've created through the African Union a surveillance ICT portal that detects early on when issue of Lassa fever or Ebola or anything else comes about. The information is spread quickly. Lessons learned can be utilized so that people don't have to continue to reinvent the wheel. And I think the African Union is key to making sure that these portals have all of the information that you need. So if you have a system working in your country and something comes up, you can just go to that portal and find out quickly what can be done so you don't wait for an epidemic to ravage your country like we did, just sitting and waiting for something like Ebola that we never thought about to kind of kill as many Liberians as it did. The African Union also is ensuring that it is present at these meetings and making their voices known. What are the things that we want to see? Of course, we want more collaboration. We want access, affordable access to drugs for those of our people who are ill. There is a manufacturing company that's been set up in Ghana that I didn't even know about till a few days ago. Manufacturing drugs, cheaper, easily accessible, because if you need it, you just order it from across the border. We have to do integration formats a little bit easier to make it easier to move around. But I think the lessons that we've learned, because as I said earlier, the challenges are actually on the African continent, can be used to help strengthen the health sector, can be used as lessons learned so that some of the issues we're dealing with can be dealt with. But we want to have affordable, accessible information and drugs and supplies to help strengthen our health systems. I think that is where we are weaker. The issue of healthcare is a poverty alleviation issue. And so as we look at healthcare as one item, those who are below the poverty level are usually those accessible to all of the diseases we're talking about. How can we, when we come to these global platforms, get information on how we can alleviate poverty, bring about more equity in our systems of governance, reduce some of the negatives like corruption and other issues that seem to take away necessary funding that we could use for putting money into education or healthcare, and listening to some of the new issues like ICT that can be used to provide information in a remote area that could have a problem. I think that's what we bring to the table: lessons learned, collaboration, cooperation, and finding ways to solve the problems that we have using local solutions.
Thank you very much, Your Excellency. Professor Takemi, you've been in this so long and you've made so much difference. So if you look forward, do you still have a dream?
What we are facing is a very serious issues of the sustainability of our universal health coverage because of aging, increasing such a large size of the elderly population, spend a lot of money and long-term care expenditures. So I really hope that every country in this global communities recognize that once achieved the universal health coverage, more difficult to sustain the universal health coverage itself. And then the process to achieve the universal health coverage should be the first part of the strengthening the sustainability. That's the reason why the health ministers should collaborate with the finance ministers. And this means that once the health ministers can more efficiently collaborate with the finance ministers, this means that more easy to mobilize their own domestic financial resources for their own process to achieve universal health coverage. This is absolutely important for the individual countries to keep the sustainability of itself, not always to rely on those external resources. It's really the weakness of the system itself of the sustainability. And also, I want to tell you that we have plenty of the international documents. The political declaration for the universal health coverage at the last UN Assembly is wonderful. But remember that the Tedros, you closely comment on it, but so many stakeholders rushed to the secretariats and requested their own sentence which reflected from their own interest of the stakeholders. So finally, the documents become a kind of a department store, covered everything. So if we read the political declaration, it's a wonderful document, but it's a very difficult to find out what is the priority, what the strategic framework is. This is what real serious difficulties. Therefore, now that the global action plan is absolutely important, especially though the seventh accelerators is absolutely important for us as a basic framework of as a common to achieve the universal health coverage. And in this process also, I want to say that in the past, most of the global health policy makings rely on the vertical approaches, such as the disease-oriented, the polio eradication, stop TB, and stop malarias, and also those are the vaccine itself. But even though the WHO defined the health system in their Everybody Business document in 2007, defined that the 6 building blocks of the health system, you know, the health finance, health information, and the health workforce, and the medical products, and the service delivery, and the governance and leadership. It's wonderful. But those of the each building blocks in the past try to collaborate with their own through the partnership approach. But unfortunately, those the partnership approach, such as the Global Health Workforce Alliance, originally it's wonderful, but they gradually lost the political momentum as a key agenda for the global health. Why this sort of things happened? We should be very careful to design again. And then we have to think that we have to widen the mandate of those the vertical approaches. Therefore, for example, the Global Fund, the Peter Sons is here, you know, and also the Gavi Alliance, says Barclays is here, should widen their own mandate, not only for their own individual original purposes, but also contribute for the health system strengthening of their recipient government. This is absolutely important new approach. On the other hand, the recipient government should have the really good governance and consistent political leadership, which is the core as the ownership of the individual government to build up their own health system to achieve the universal health coverage. In this case, the good governance is a really core part of the coordination body among those the domestic players and external players. Therefore, we should combine those the good governance and consistent the political leadership, the one side on the bottom-up, you know, decision-making, and top-down process, we can say that those are the vertical approach. They should have those a wide mandate, and combine those two different approaches under the one umbrella of the universal health coverage. This is, I think, the new approach which we have to seek in this global health policy making. Thank you very much.
Thank you. Now there's a dream if you want one, and we'll take that up in our next discussion on the action plan, where exactly those kind of issues come to the fore. We only have a few minutes left. I would first like to ask Dr. Giannini to give us 2-3 sentences. What can health learn from education? You've now been in both systems. Is there something education does better than health?
Key message, very, very simple to put like this, is that healthier children are likely to become healthier adults. So I think that this is something that can really explain the role of linkages between health and education. And healthier children can learn better and have a real successful journey, the educational journey, and this is something that can really encourage to cooperate more and more. But let me also share in a few words our desire, expectation, maybe dream. This is about that health and well-being education is recognized as essential for addressing health, social determinants for health. And this is about through health programs, teachers training, everything which is around also involving the community around learners. It's possible to do. We have already quite successful program running in many countries, and I think that this is the right way to go, thinking and acting differently. Business as usual is not what we need to implement the ambitious 2030 agenda.
Yeah. Thank you, and that's exactly the SDG message we need. So to round up this panel, this is something Dr. Tedros loves doing after he's been listening, to combine what he has heard and leave us with 2-3 key messages in relation to health is a political choice. Please, Dr. Tedros.
No, thank you. Very difficult to summarize, but I have been listening carefully and I have taken note of almost all the issues raised. It's a very good opportunity for me actually to learn, to continue to learn. But as you said, I will say maybe a few words. Sorry, but I will repeat what I said earlier. I'm a very strong believer of health as a political choice. And maybe I will tell you my own understanding. The first time I saw health services or universal health coverage working in action is actually in Denmark. That was in 1988. And I was really surprised because I was there for 4 months, from August to December. And this was like 4 or 5 months, and I was covered for the whole year. I was just there for a study, and I was surprised because to know that every Danish is covered, plus a visitor like me. Then I saw, okay, so UHC is something that can happen, and this is in action. And then after a couple of years, I saw UK's NHS, and again as a master's student, I was covered again. And I had this interest to understand the UK system too, Denmark, UK, and then of course started to understand the Bismarck model of Germany, and I had another cover again when I did my study in Sweden. But there was something that impressed me in the process. The countries who have good service, actually good UHC, like the UK, it didn't start when the country was economically strong. UK actually started its NHS immediately after the Second World War, when it was on its knees and its economy was shattered. And the same is true, by the way, with Japan, the 1960s, when they had UHC. And then you see Germany more than 135 years ago. All you see in common is a political choice. If you go to Africa, the same. I brought Liberia as an example earlier, but if you take Rwanda or other countries, you see that there was a conscious political choice, and that's very important. But I fully also understand that to make that choice, there is a belief that you have to really take to heart, which is health as a human rights issue, an end in itself, as an outcome. But at the same time, if you want for something else to justify it, not only it's a human rights issue, an end in itself, it's actually a means to prosperity, a means to development. So you have actually two advantages. One is it's a rights issue. We have to provide it, an end in itself. But it's a healthy society that can bring prosperity, so it's a means to development. And who would ignore this fact? Who would say investing in health is a waste? It's actually an investment. And then when you couple it with education, that's the human capital, it's actually countries who have made progress, who invest in health and education. Some countries were completely destroyed, by the way, during the Second World War. They revamped it in 10 years. Why? It's the human capital, the health, and the skills that you cannot destroy, actually. So the human spirit and capital can rebuild that country again. So investment in the two is important. And the other thing that we need to link with this is what our Vice President said, the gender equality. So how can we see investment in health, investment in education, and investment in others in the prism of gender equality, an honest understanding of the benefits that comes when we bring gender at the center of everything we do. I think with that, change can happen. But all these are actually political choices that needs commitment at the highest level possible. And our ambassador had already stated that very, very, very clearly with his own experience and the commitment at the highest level possible, how that can lead us to make the right decisions and make UHC happen. So for me, that's why I always say all roads should lead to UHC, because it's possible, because no reason can justify, not to invest in UHC. And it's only a matter of political choice. Some choose to do it, some others don't. But since it's a rights issue, we should all do it. And we should also accept that if we see it in terms of investment, it's a means to development. So there is added value. So we have to make it happen. Finally, I would like to thank Detlef, our brother, for all his commitment throughout and for bringing us all together. And all my respect and appreciation, Detlef. I would also like to congratulate Makerere University. The World Health Summit in April will be hosted there. And the right choice, it's our pride, and it will be 100 years in 3 years now. It will be 100 years old, Makerere University. And thank you so much to Detlef and other leaders of the World Health Summit for making a choice of Makerere, which is the right one, and very proud. And also would like to assure you that we will do everything to make that summit a success. So thanks again for this opportunity. All roads should lead to UHC. Health for all. Thank you.